All right, good morning, everyone. Hopefully you guys in the back can hear me. Good? Okay, thank you. TrueNity Health, we turned pharmacies into tech-enabled care hubs. So this is Beth. She lives in a rural town in North Carolina. She's 74 years old, and she skips regular checkups with her doctor because the doctor is about an hour away. Until one day, she ends up in the hospital for an acute symptom that eventually leads to a heart attack. This could have been totally prevented for Beth if a local resource she visits on a daily basis could have helped her. Unfortunately, that local resource, the pharmacy, could not. At TrueNity, our mission is to basically turn pharmacies into clinical care hubs so people like Beth can receive the care they need in a timely manner. Our rural healthcare is broken. 68% of Medicare patients today have at least one chronic condition. And there are 19,000 pharmacies ready to help them. Unfortunately, due to outdated regulations and regulatory capture, they cannot. Today, they're stuck in dispensing medications only and not clinical care that the senior aging population needs. What we do at TrueNity is we turn these pharmacies into scalable clinical care hubs. Our all-in-one platform essentially automates identification of patients with chronic conditions. These patients are visiting these pharmacies on a weekly basis, and these pharmacies can provide clinical care to them within 14 days of a conversation they start with us. What this does is it improves patient outcomes, prevents hospitalizations and unnecessary hospitalizations, as well as it creates new streams of clinical revenue for these pharmacies, which is what they need today because of small shrinking margins and other regulatory processes that are going on that's preventing them from generating revenue. At the core of what we do is our AI co-pilot. We believe at TrueNity that technology does not replace human touch, it augments it. So what we do is use AI to summarize thousands and thousands of pages of documents, medical histories, medications, and we summarize them and bring this to the pharmacies and the pharmacists so they can provide the care that the patient needs. We also identify patients according to their conditions, as well as their insurance, Medicare Advantage insurance, as well as other identifiers that helps them ideal for the chronic conditions that they need care on. As well as our whole thesis is if we're going to be successful and scale this to 19,000 pharmacies across the US that are independently owned, we need to have automation where pharmacies can support this platform without hiring new staff. We're growing fast. Over the last 12 months, we have had 400x in revenue growth. We served over thousands of patients today across 13 states, and we have two streams of revenue, which is clinical services, where we land into accounts, and then we expand with our software or SaaS-based services. And we're trending towards profitability, hopefully by end of the year. In healthcare, success is measured based on the impact you have on the community and the customers you serve. There are two impacts that we have measured over the last 12 months. First, patients that are enrolled on our platform for over 90 days, because of the interactions of their local pharmacies and the pharmacist, they have seen reductions in their systolic blood pressure by 10 points. Studies have shown what this leads to is about 20% decrease in heart attacks. Second, as I mentioned, pharmacies are struggling to create new revenues. Because of the positive outcomes they're producing here, they're also essentially creating new streams of clinical revenue where this is keeping them afloat when the time is needed the most. Again, we have two streams of revenue. We call our clinical services our land strategy, which is we land into accounts providing services for our pharmacies where they don't need additional staff to essentially handle all of the critical clinical services they need to complete on a monthly basis. That's a high margin business for us. And what this allows us to do is reduce our cost of acquiring a customer and essentially upsell them later on to more important SaaS-based service, which is our care management service. Why do pharmacies choose us? Over the last 12 months or so, we've built a massive moat. One is providing an all-in-one platform where pharmacies don't have to go out and piecemeal things together. We bring smart devices, medical billing, we bring provider oversight, compliance, security. So all pharmacies have to do is just sign up on our website. We have a 1-hour call, and 2 weeks later, they're offering critical clinical services to their patients. And as I mentioned, they don't need to hire any additional staff to support or to roll out these services. And the most important moat we're building is we're leveraging the relationship between the pharmacy and the patient. I don't know how many folks visit a rural town or live in a rural town, but if you go to a rural pharmacy, you will see patients literally go there on a weekly basis, and these folks know the patients and they understand what they need, and we leverage that service. So a couple of slides here. In terms of our go-to-market and our TAM, our first 3 use cases have about a TAM of $20 billion in reimbursable service. We're currently only at use case number 1, which is remote patient monitoring. We need to capture about 1,000 pharmacies to get over $200 million in revenue, and we're already on our way. The platform is built by experienced founders, physicians, former pharmacy owners, and some are still current pharmacy owners. And we have built technology that is scaled from 1 million to all the way up to 100 million. Our last slide is our funding ask, which is we're raising $3 million to reach $5 million in run rate and profitability. And majority of the funding will be used for market expansion or upselling our current customer base, expanding our AI capability, as well as achieving some of the critical security compliance infrastructure upgrades that we need in order to support at scale. So again, we're truentity, and we enable pharmacies to become clinical care hubs. Thank you. By the way, these are our customers, and we have a tradition, probably not the right thing, but when we bring a customer live, we give them cookie cakes. They're filled with lots of sugar. And we're dealing with chronic conditions, but they love it. And this is, every time we bring a customer live, we do this.
So this is obviously a pitch where the business has traction that's more mature. So as thinking about a $3 to $5 million capital raise, all the economics, I think, behind this are probably the most interesting thing. Tough in 6 minutes, but like the relationship between yourself and the pharmacy, the economic relationship, I kind of gleaned that they get 20% of that first bit, you keep 80%. I think that's what it said. But like, I would want to know a little bit more about the economics of that. And then, I think you're in a compliant industry, right? And so investors are going to be concerned. I would ask questions, as would other mature investors, about kind of what the implications of compliance are related to that and what the risk is associated with that. Yeah. But the idea of driving incremental revenue to an established retail that probably is looking for additional revenue streams, I think, is a fantastic value proposition. I'd love to hear in a pitch deck like this from a business like yourself that has traction. I'd love to hear from a couple of your pharmacists in it. Like, I'd like to hear from customer directly, like, hey, this is what it's done for my pharmacy business. I've got an investment in a concierge medicine business that's done incredibly well, and I find that aspect to be really interesting. This feels to me a little bit like a way to approach concierge medicine for lower income and rural populations where they can get a little more attention. It's more accessible. I think it's a very, very interesting idea. I want to know a little bit more again, which I'm sure you have in a bigger deck, about the economics between yourself and the pharmacy. The other thing with this too, and I don't know, I'd be curious about the specifics of the go-to-market around sales and sales expense. Do you need to build an enterprise sales organization for this? Do you need to visit all 19,000 pharmacies? I know they could sign up online, but I don't know what the cost associated with employing the people that are necessary to get out in the market and convert would look like. Sometimes things in the healthcare space will require a pretty deep conversation and relationship and a lot of discussion, which can be an expensive sales model, which is probably fine here within the economics of that. But that would be the other thing I would think I would want to hear a little bit about, because you're already in market, you're doing well, so then it's a cost to scale thing against the capital. So anyways, very, very interesting. Looks good, but I'd love to hear from some pharmacists. That would be the only thing I'd add a little bit to in a short pitch.
Okay, perfect. Great. Thank you.
I know this space well because I used to be in remote patient monitoring. Are you, so I'm assuming independent pharmacies are phase one of this. What's the next?
So right now, there's a couple of reasons why we went down the route of independent pharmacies. One is they are more prevalent in the rural area than retail chains, because retail chains, whenever times get tough, they shut down and they go away. Versus real independent pharmacies, they're there for generations. So we're only focusing on independence, but it's a part of our three-stage strategy. We call it our blueprint for improving healthcare. Phase one is getting pharmacies to essentially deliver critical clinical services. Phase two is going to payers or insurance companies and having them provide the pharmacies the HEDIS measures, which is essentially, you know this, right? HEDIS measures that they need to handle. And phase three is clinical trials, because we saw during COVID, the most underrepresented population during COVID trial was the folks from the rural area. The reason why is because there's no data available to them. So we believe by having the strategy of phase 1, 2, and 3, we can actually put a groundwork there for the pharmacy. So, and right now it is going to be independent for us.
Gotcha. And then with RPM, are you going to integrate wearables in this in the pharmacies, or how are you doing the remote patient monitoring with the pharmacies, or how are you communicating with them?
Yeah. So part of, as you probably know, part of CMS regulation is a medical clinic as well. So we have to purchase smart devices for our patients. So we purchased the devices and we tested many, many devices. And the ones we found that were the most useful for the aging population were devices that you just plug and go. So essentially we have devices that are cellular based, that they get a little gateway, they go home and they plug it into the outlet, and then they take a reading, the gateway transmits that to us, the pharmacy receives it, and they get active care and everything.
Yeah,
So
I was curious, I didn't know if they were actually wearing it on the body, or if they were, but our biggest cost center when I was doing this work was people either jailbreaking the devices or walking away with them. So that's why I was curious.
That's why we only support three chronic conditions right now. It's hypertension, type 2 diabetes, and congestive heart failure. So very hard to break those devices, and these are the devices, a blood pressure machine, a blood glucose, and a weight scale, something that all aging population folks have. So it's very easy.
Well, if glucose is one, you got to ditch the cakes then.
Yeah,
You got to ditch the cake if glucose is one of your outcomes. You got to give them a fruit tray or something. No, I think it actually is really interesting, and I think you've picked a market that, at least at Black Pearl Global, we are hyper-focused on. So I think you're both timely and working on something that makes sense. A lot of people have doubled down on telehealth, but they are incorporating AI in healthcare, and it doesn't make a ton of sense other than tech for tech or health tech for health tech's sake. And I think you're doing something that makes a lot of sense and doing it in a very thoughtful way. So good job.
Well, I have one question that made me think of that I forgot to ask you. The rural thing, obviously it sounds like that's part of just kind of getting traction in the market, but I've noticed a trend. I know my family has too. I mean, even in urban centers, we're going to local pharmacies again. I have one around the corner from my house. I love the guy. And I think I went in there the other day. I thought I was having a heart attack. I was like, can you put the paddles on me? He's like, dude, you should go to the hospital. I'm like, it's so hard to park at South Park. I don't want to drive all the way over there. I'd rather die here, right? So I'm just wondering if why, I mean, the emphasis on rural I get because maybe there's a departure from some of the chains and stuff, but why couldn't this be at, I go to Oakhurst or a couple others, like why couldn't it be there in an urban center as well too?
Yeah, great question. I think for us it's focus, and right now we believe our solution is best fit in rural where most of the aging population lives and that have the chronic condition. So it's all about focus for us, and it also builds into our overall 5-year strategy of the blueprint, where rural area and some of the folks are always underrepresented when it comes to clinical trials. And so we want to make sure we're capturing, this market here and making sure they have a voice essentially. And let me tell you, it's a big enough market, and there's plenty of reimbursement available for folks in rural area where they need this.
Is that what the 19,000 number was rural independent pharmacies, or was that the national?
So altogether, there's about 60,000 pharmacies across U.S. A third of them are independents, and independents are mostly in rural areas.
Great job, Mike. Just a couple quick things to add here. Love the use of AI in some of these like very manual process industries. I think healthcare and specifically in pharmacy workflows, it's ripe for disruption. Like there's so much automation that can happen, and I think you guys are right at the forefront of that. You sort of started off with the story about, I think it was Betty, the patient. I love that. Like it brought some emotion to the story. I think the challenge is that it sort of got me thinking this was like Betty was the end customer, and like it was really focused on designing solutions for her, but she's not the one paying for it in a lot of ways. So I would love to just hear more of like, hey, what is sort of the more important core value propositions to the pharmacies? What is sort of the ROI they're going to be getting out of it, and what pain points are you solving directly for them outside of generating new revenue? The other thing, just a couple sort of things to nitpick at here, but you said you guys were going to be profitable later this year. I always like hear founders say, hey, we're going to be profitable. And I'm like, why are you raising capital? Like venture capital is just a tool. Like it's not the reason to build a business. And so, hey, if you don't have to sell more of your company, why would you? There always is a reason to raise strategic capital to accelerate or go after new markets, but we'd just be more clear on like why you actually need capital at this point in the growth story. And then I think just last thing here, like it was sort of confusing on the business model and product side of things. Like you said, you had care management, which was like the SaaS component, probably high margin product. Then you also have clinical services, which is, I assume it's more kind of like service-based revenue. Is the revenue traction SaaS today? Is it services? Like, like sort of double clicking on Steve's point, like what is the gross margins on this business today? Is it a SaaS company? Is it not? And then how do you scale and sort of form your capital strategy accordingly?
Can I just answer a couple of the questions? Yeah, so the first one about the customer, we always talk about this at the team level. Yes, we sell to the pharmacies, but our end customer is the patient. If we can't change the outcome for the patient, then everything else we do is no good. And that's where I talked about the impact. So it is about Betty, or Beth was her name. That's okay. So it is about, it's actually a true patient story that we changed the name, and it's actually a patient in North Carolina that was kind of the inspiration with a lot of this stuff. But anyway, so patient is our end goal, right? And that's who we manage, that we serve at the end. In terms of a capital raise, and this is you hit it, you hit something that's kind of a debate within our internal team. Should we go and raise right now? And for us, it's like, look, we can get to profitability by November of this year, or yes, we can do that, and we can kind of grow slowly, like 30, 40, 50 pharmacies a year, or we can go and scale this with some additional capital because we have a blueprint now on how to be profitable or how to get profitable. So that's one of the reasons why we think we want to raise right now, or not we think, we are going to go raise. And that's kind of our strategy behind that. Yeah.
I want to add to his comment that not only is venture capital a tool, but so are the people that provide it typically. So I'm just kidding. So I just wanted to, if there, to the degree to which there is still a debate in your organization, which it sounds like there may not be, I just wanted to offer a little bit of advice. Yeah. Do not take any money from anybody ever unless you have to drive your business, because your ability to maneuver in a market that's highly technical, that's regulated, that could require some real nuance at scale, is it's driven by your ability to sit around the table with your founders and do the things you need to do to drive the business, to keep the patient at the center of your model, to do the things that are right. Mm-hmm. I think a lot of people raise money that don't need to. I don't know if you do or not, that's your call, but like if there's any of that debate left, I would really consider that very carefully. Because, you know, I provide capital, so I ruin companies too, not just these guys. But I just think it's one of the most fundamental and important decisions that you have to make. And it is a rare gift for somebody early stage as an entrepreneur to be on a path where they can see green. And man, if that's in your sights, I'd do a lot of
Build a business.
A lot of
Build a
soul
business.
searching. Yeah.
And also take money from someone who doesn't put you on the fundraising hamster wheel, right? At the end of the day, like you want someone who's going to help you create optionality. So in the future, like you can choose to raise, you're not being forced to raise.
All right. With that, let's give it up to Mike.